Tedros Adhanom Ghebreyesus is an Ethiopian biologist, public health researcher, and official who has been Director General of the World Health Organization since 2017. Tedros is the first African in the role, and was endorsed by the African Union. He played a personal role in the response to both the Ebola outbreak and the COVID-19 pandemic. Before serving as Director General, he held two high-level positions in the government of Ethiopia: Minister of Health from 2005 to 2012 and Minister of Foreign Affairs from 2012 to 2016. Tedros was included in Time magazine's 100 Most Influential People of 2020. Tedros was born in Asmara, at that time part of the Ethiopian Empire as the Eritrea province, but now the capital of Eritrea following its secession in the 1990s, to Adhanom Ghebreyesus and Malashu Weldigabia. His family originated from the Endator of Rajja of Tigray province, Ethiopian Empire. Tedros recalled that as a child he was very aware of the suffering and death caused by malaria. His younger brother died at the age of 3 or 4 years, possibly of a preventable disease like measles, which Tedros often discusses as a defining personal experience in regards to the need for global health care. In 1986, Tedros received a Bachelor of Science degree in biology from the University of Asmara. He studied at the London School of Hygiene and Tropical Medicine and was awarded a Master of Science degree in Immunology of Infectious Diseases from the University of London in 1992. In 2000, he earned a Doctor of Philosophy in Community Health from the University of Nottingham for research on the effects of dams on malaria transmission in the Tigray region. In 1986, after his first degree, Tedros joined the Ministry of Health of the Derg as a junior public health expert. In 2001, Tedros was appointed head of the Tigray Regional Health Bureau. In 2003, he was appointed a state minister for health, and served for just over a year. In October 2005, Tedros was appointed Minister of Health of Ethiopia by Prime Minister Meles Zenawi. At this time the Ethiopian Health Ministry faced challenges that included poverty, poor infrastructure, and a declining global economic situation. Ethiopia employed fewer doctors than the number of Ethiopian doctors working in the Chicago metropolitan area. A review published in Global Health Governance considered progress in health indicators during this period to be significant. The Health Ministry's activities from 2005 to 2008 were supported by $1.9 billion United States dollars in development aid, increased focus on links between community and centralized health systems, and less exclusive attention to HIV, AIDS and malaria. Tedros designed the health workforce flooding reform strategy that has resulted in the training and deployment of thousands of doctors, nurses, pharmacists, laboratory technologists and health officers. This program included the construction of 4,000 health centers, trained and deployed more than 30,000 health extension workers, and developed a new cadre of hospital management professionals as part of a health extension program. A 2011 demographic health survey suggests these efforts reduced Ethiopian infant mortality from 123 deaths per 1,000 live births in 2006 to 88 in 2011. As Minister of Health, Tedros was able to form a close relationship with prominent figures and organizations including former American President Bill Clinton, his Clinton Foundation and the Bill and Melinda Gates Foundation. In 2010, the U.S. State Department named Ethiopia as one of the U.S. Global Health Initiative Plus countries, providing the country with greater access to resources for public health projects. During his time as Minister of Health of Ethiopia, Tedros was very active in global health initiatives. Ethiopia was the first country to sign a compact with the International Health Partnership. He was chair of the Rollback Malaria Partnership Board as well as the Institute of Health Metrics and Evaluation and the Stop TB Partnership Coordinating Board. He was also a member of several academic and global health think tanks including the Aspen Institute and Harvard School of Public Health. He served as Vice President of the 60th World Health Assembly that was held on the 14th to the 23rd of May 2007. From 2008 until 2009, he was a member of the High-Level Task Force on Innovative International Financing for Health Systems, co-chaired by Gordon Brown and Robert Zoellick. In July 2009, Tedros was elected board chair of the Global Fund to fight AIDS, tuberculosis and malaria for a 2-year term. In a profile published in April 2010, The Lancet reported that Tedros was a household name at the Global Fund Secretariat before his election as board chair, where his leadership was regularly cited at the Global Fund that resulted in Ethiopia being named as an exemplary high-performing country. The rate of child deaths fell by 30% between 2005 and 2011. Infant mortality decreased by 23%, from 77 to 59 deaths per 1,000 births. While